So first talk is Microkeratome versus Femtosecond laser assisted Salk, a randomized controlled trial. The chief and presenting author is Mrinalini Singh.
A very good afternoon to everyone. I'm Dr. Mrinalini Singh, and I'll be presenting my work on a randomized controlled trial between microkeratome assisted and femtosecond laser assisted superficial anterior lamellar keratoplasty. Various causes of superficial corneal opacities, they lead to 1.5 to 2 million cases of monocular blindness per year globally. And various surgical options are available besides lamellar keratoplasty. But our RCT was for the first time aimed to compare the two surgical techniques, that is microkeratome versus femtosecond laser assisted Salk. It was a prospective interventional single center trial, randomized controlled trial with a sample size of 72 eyes, and it was aimed to compare the various outcomes between microkeratome and femtosecond laser assisted Salk. Visual acuity was our primary outcome. We included superficial opacities within superficial 200 microns of cornea and excluded those deeper than 200 microns. Thorough preoperative evaluation was done. The 72 eyes were randomized with a simple randomization into two arms. The study arm had 36 eyes which underwent femtosecond laser assisted Salk, and the control arm underwent microkeratome assisted Salk. We followed up our patients for 6 months. Femtosecond laser assisted Salk was carried out in femtosecond OT, where pre-fed data was fed in the Visumax femtosecond workstation. The donor cornea was mounted on an artificial chamber, and epithelial scraping was done. It was followed by the removal of the lenticule, and similarly recipient cornea was prepared using femtosecond laser. And recipient bed was prepared. The donor lenticule was mounted on the recipient bed and was secured with glue. This was followed by placing a bandage contact lens for around 24 hours. The microkeratome assisted Salk was similarly carried out in our main OT on Gibor's automated microkeratome, and donor and recipient lenticule of similar thickness and diameter were created, and donor lenticule was secured on recipient bed with glue, followed by BCL. Our results showed insignificant differences in between the BCVA in the two groups after a period of about 6 months. And similar insignificant differences were found in various secondary outcomes like contrast sensitivity, K readings, corneal thickness, corneal abrasions, and even the development of complications. So we could conclude finally that microkeratome assisted Salk is non-inferior to femtosecond laser assisted Salk for the treatment of superficial corneal opacities. This alleviates the apprehensions of the surgeon in choosing between the two techniques, and the surgeon can make a choice as per their expertise and resources. Thank you.